When we think about what is the impact to medical groups and physicians and other clinicians, who's going to be impacted? What's the profile of that clinician? Is it by specialty and maybe a combination of how they practice, what their procedural mix is? Maybe is there like a specialty area that jumps out to you, like primary care, medical, especially hospital-based procedures kind of jump out to me a little bit when I hear this. Is there an area that you think is going to be disproportionately impacted by this change?
Thankfully, primary care is likely going to be fairly safe because E&M codes are exempt, so they're not going to have the adjustment. Our surgical specialist, particular things that are long, effort intensive or typically effort intensive that have a high intra-service quantifier, those are going to be impacted the most. So I think right now the two specialties that are sticking out the most are invasive interventional cardiology and neurosurgery. So again, two specialties that have very intense procedures that overall will see big impacts in the reduction for a specific service. The flip side to that, and there's been a lot of analysis about this because everyone's looking at which procedures have the highest intra-service numbers. So where are those going to get cut the most? But what's not really been focused on, except in a couple of places, has been the high volume areas where maybe the total work RVU is not really high, but the intra-service portion of the total work RVU is large. So I think endotracheal intubation is high volume. It does not have a very high work RVU, but the portion of inner service, the inner service portion of that work RVU is significant. So you've got a lot of volume and you've got a big part of that service that actually is going to be hit with the 2.5%. So whether it's, high inner service value with low volume or high volume with maybe a lower total value, but a higher portion, those are our places where we're really going to be looking. So right now, everyone is still worried about cardiology or interventional cardiology and neurosurgery, but I think we're going to see some of those higher volume procedures in areas start to feel the impact probably equally so as the specialties are.